Gen Zers are saying that antidepressants have ruined their sex lives and are leaving them feeling dead inside. This was a headline for an article published by the New York Post, which I believe is uncovering one of the biggest scandals of our time, which have to do with the widely prescribed SSRI medications. For those of you who don't know who I am, I'm Dr. Josef Witt-Doerring. I'm a board-certified psychiatrist, and I'm an expert in psychiatric drug reactions. Now, back in 2014, when researchers looked at how many people were taking antidepressant medications, they landed on the figure of 14% in the United States. It was slightly lower than 14 for men, but it was a whopping 19% of women, adult women in the US, were taking these medications. And that was back in 2014. Now, since the pandemic, this has gone up and even more people are on these medications. So it's very important to understand risks, which we're going to be covering today, which is post-SSRI sexual dysfunction. Let's read through this article and I'm going to give you my commentary. So the first piece of this describes Nick, who was 19 when he visited his psychiatrist's office, and they gave him an antidepressant called Trintellix to treat his anxiety and depression. At the time, he didn't think it was a big deal, but then 6 years later, when he decided to come off the medication, he noticed that his genitals were starting to lose sensation. Over the course of a couple weeks, he almost entirely lost feelings in that area and it never returned. Nick went on to say that that region feels as sensitive as the skin on the back of his elbow does. Now, what Nick's describing is how PSSD emerges for many people. So let's first define that. So post-SSRI sexual dysfunction is a side effect that has been talked about in the medical literature for the last 20 years. And essentially what people find is that when they get on these antidepressant medications, they'll notice some sexual dysfunction. That's really common. Most people on antidepressants have sexual dysfunction. When they looked at it in clinical trials, it's anywhere from 50 to 70% of people. But people think, that's just part of being on the drug. And when I get off it, it's going to go away. But unfortunately, that doesn't happen for everyone. And sometimes when people come off the drug, it's that act of coming off that triggers the emergence of this PSSD syndrome. Now, the way most people describe PSSD is through something called genital anesthesia. And that's when they stop having erogenous sensation in their genital area, just like Nick was describing. He said it felt like he was touching the back of his elbow. So the men, they have problems with erectile dysfunction, and then the men and women have problems with muted orgasms as well. And it's extremely frightening, and they don't know what's happening to them. Now, there's more to this condition, like emotional and cognitive effects, which we'll go on to discuss in a little bit. But the thing that I want to bring up here is that most people feel incredibly betrayed by their doctors when they get on this, because doctors don't tell their patients that they could develop enduring sexual dysfunction even when they come off this medication. And unfortunately, for some people, it appears to be permanent. Now, everyone wants to know, how common is this? The truth is no one really knows, but the one group who did look into this said it was happening. This was a group of Israeli researchers. They said that they estimated that it was happening in about 1 in 216 people. And that was this study from researchers from Howard University that was published in the Annals of General Psychiatry. And just going back to this, when people find out that they have this, they are so upset that they were never told about this, because really this condition has been discussed in the medical literature in several articles since 2006, and also is a listed side effect in the Prozac drug labels, and is a warnings and precaution, which is one of the highest levels of drug warnings in several countries around the world, like the European Union, Australia, and Canada. And that's exactly what Nick says here. He just wished he was counseled differently that when he was growing up. Because I guarantee you, if when you were a kid and you were sitting there with your parents in the doctor's office, and they said to you, well, we can put you on this medication, it'll help with your anxiety and depression, but there's a rare chance that this could lead to permanent sexual dysfunction. That's a serious risk. That's enough of a risk for a parent or a teen to say, hey, I'm actually going to avoid this unless I have the most severe and crippling depression and there's no other option. We've essentially robbed people of that choice. Now, it's a whole nother story why the FDA hasn't put this in the warnings and precautions, and it only exists currently in labels like Prozac, Zoloft, and Paxil. But that's another story. FDA, from what I hear, is reaching out to people, conducting an investigation on this now. And so hopefully the labels are going to be changed soon. Now, the people that suffer from PSSD also end up in a really bad area because obviously their life has been changed forever, but there's really no researchers looking into fixing this condition. After all, research costs money and there's no incentives for a pharmaceutical company to fund research into curing this side effect. We don't have any mandates that make them do it. And yes, there are organizations like the NIMH and different government bodies, but really to date, they've shown no interest in helping people with this condition. And so these patients find themselves in this position where they've developed this side effect. They were never warned about it. And there's no organized effort by or any authoritative medical or research groups to really get to the bottom of this. They are completely abandoned. So let's move on in this article. So now this side effect is particularly a concern because of the growing number of teens and young adults being prescribed these medications. According to the American Academy of Pediatrics, the rate of prescriptions of those 12 to 25 jumped about 2/3 from 2016 to 2022. Shoot, that's nearly a doubling, due in part to the pandemic. And the new health secretary, Robert F. Kennedy Jr., has pledged to look into antidepressant side effects. We need to be doing this, people. We have an overprescription problem in our country. And it's due to a lot of things. I think some people will say, for young people, it's due to mobile phones, it's due to social media. And those things can be true, but there's other factors to it. I think America is one of the best places in the world where it comes to dispensing meds. It has, the pharmaceutical industry has done a great job at convincing children, parents, and schools that these drugs are safe and effective and they have minimal harms when obviously they don't. We have hospital systems that churn through patients quickly. They're run by private equity. We have the insurance system compensates people more for quicker and quicker visits. And so here, especially in the US, it's just like so easy to get put on drugs in these like 15-minute visits. And on top of that, we have a culture right now that celebrates being anxious and depressed. They sort of present them as this marginalized and oppressed group. As you know, if you've been in the United States for the last 10 years, that's like a hot thing at the moment. People, they want to identify with, marginalized and oppressed groups. I know I'm probably stepping on some toes here, but I spend a lot of time on TikTok because I run a business and I do social media things. And I just see people and they're out there and they're just like, hi, I have depression and bipolar disorder, and I'm going to fight the stigma against this, and look at all the meds I'm taking, and they show it. It's a full-on identity now to have a mental health condition. And I think people just, they latch onto it because we celebrate in this country, having problems and being marginalized. And the issue with that is if you're like a kid and you're watching this, it just seems ubiquitous. It's like, everyone's taking antidepressant medications. Everyone has these problems. It's not a big deal. And I think a lot of these things are just fueling a massive surge in people saying, oh, it's just depression. It's just anxiety. You need to get treated. It's really normal. There's celebrities doing it. And we need to stop that. We need to stop normalizing taking psychiatric medications and making people feel like they're safer than they are when they're not. Okay, so let's go on and let's check out the story from Philip from Maine, who said that when he was 6 years old, he entered a prescription cascade. He calls it a doom loop. Here's Philip when he is 6, and apparently he was flagged as being ADHD by his teacher. He was prescribed a stimulant, and then when he stopped taking it at age 12, he became depressed. Surprise, surprise, coming off stimulants will lead to a crash, and so the doctor put him on Prozac. He immediately noticed feeling sexual numbness and muted emotions, and now that he's off Prozac, it's been over 2 years, it never got better. He says that all the positive emotions are completely gone. He doesn't feel any highs anymore, but he remembers feeling them before he got on the medications. His doctors and therapists agree that he has a PSSD diagnosis, but they're not able to offer him any relief from his symptoms. And Phillips suspects that taking these drugs messed with his developing brain because he was going through puberty and it has changed his blueprint. And now it feels like his body doesn't know how to revert back to it. So this is another side of the PSSD condition, which is frequently missed by people. They think that it's just a sexual problem. They think that when people get on these drugs and it causes these permanent changes, it's just sexual, but it's not. I've talked to probably 20 people, maybe more or so, with PSSD on our YouTube channel. We interview them regularly to share their story and to do journalism about what's going on. And the symptoms that these people complain about the most are actually emotional and cognitive. It's not just sensory blunting that's affecting the genitals. It's also affecting the emotions. So these patients talk about feeling dead inside. They feel like they're watching their life happen, 2D through a computer. Now, How does that play out in real life? Let's talk about some of the things they say. They say that when they hug a loved one or a friend, they feel no warmth or connection to them. When they hear their favorite song come up on the radio, there's no prickle on the back of their neck where they say, oh, and they have that nostalgia and they think about it. Some people are so blunted that they don't, when they drink high amounts of alcohol or even use drugs, they don't feel it. And so something has happened that's really turned off their ability to feel. They feel like their soul is lost. They feel like they're watching their life play out in front of them, but they're not engaged. Oftentimes with this, they have very low motivation to do things or engage with their friends. And another piece of this, for those who are really sick with PSSD, they actually have cognitive impairment as well. They struggle to think straight. It can get in their way of their ability to work. And so contrary to what many people would think, that, this is just a sexual problem, that's what people are worried about. It's not. It's an emotional and a cognitive issue. It's a whole constellation of symptoms that happen. And these people are really, really most disturbed, like the sickest ones are most disturbed by how they just don't feel alive anymore. Okay, so let's move on from Philip. The next person we're talking about is Elliot, who was a 24-year-old dishwasher from Atlanta, Georgia, diagnosed with ADHD as a child. And he struggled with emotional outbursts, which is a common symptom of this condition. When he was 18, a psychiatrist prescribed him Zoloft to help with his emotional regulation. He said the med didn't help at all, and so he stopped it just 6 months later. But immediately he noticed the symptoms of PSSD in his genitals and a lack of emotion. Wow, that doesn't seem like very long, 6 months of use to develop that. I've heard this before. I've heard people develop this even after a couple doses of the medication, which makes you think, what is causing this? The only thing that makes sense to me is that there is a genetic susceptibility for some people. I've seen it happen when people just start the drug. They get on it and it causes a toxic reaction, which harms the nervous system. And then they fall into this. I've also seen a lot of cases where people, they have sexual dysfunction on the drug. It's manageable, but it's noticeable. And then when they come off, there's something about that withdrawal that triggers this. It's hard to know exactly why this is happening, but it seems to be genetic, and it doesn't seem to be dependent on the duration of use for all people. It can happen really quickly. And what Philip says going on, he says, no one can really comprehend what it's like. You lose all spark in life, you lose all enjoyment of things, and everything becomes bland and gray. Yeah, this is a super isolating condition because you look normal on the outside. You can do things, you're fairly functional. But when people ask you how you feel, you say that you're dead inside, and people don't understand that. And the world is happening around you and you're trying to relate to other people and being excited about things, but you're just constantly reminded about how different you are from everyone and how you don't feel things. And this can drive people to want to take their lives because they just have no connection to the world and the people around them. And they're really misunderstood, not just by the people that know them, but also by doctors. To add insult to injury, he says that looking back at things, he actually thinks he was misdiagnosed and that he didn't even have ADHD. He had autism, which he believes never should have been treated with the medications. The next person in the story was Rebecca Kane, who was put on Zoloft at age 15 for obsessive compulsive disorder. She was never given the option to do anything like therapy, like exposure response prevention treatment, which has a good track record of treating OCD symptoms. But instead of that, she was essentially just put on this medication. And she says she experienced complete genital numbness and emotional numbness, but it was brushed aside. She was told not to worry about it because this was just in her mind, and it was a temporary trade-off to get rid of the OCD at that moment. Now, a year and a half off the medication at age 17, she stopped Zoloft and went to college to study. And she says her side effects never went away. In fact, they worsened with withdrawal. Again, a common presentation for this. And this is not just antidepressants. When it comes to the antipsychotic medications, there's a condition called tardive dyskinesia. It's a permanent movement disorder. And this classically presents when people taper off the antipsychotic medication. So there is something about withdrawal from these medications. There's something about removing them that can trigger some permanent damage in some people. She goes on to say that she tried other antidepressants to no avail, and that she feels like she was lobotomized and like the complete atmosphere of the world was gone. She said the OCD was bad, but it was better than completely losing your identity as a person. Again, these people are describing an intense state of dissociation and disconnection from the world, which happens when your sensory system globally has been disrupted. They don't feel connected to others. The next section of this talks about Meg Jay, who's a clinical psychologist at the University of Virginia, who is talking about what we all know to be true and what RFK is looking into, that there is a big over-medication problem and that physicians are too quick to medicalize normal young adult struggles and essentially put people on these meds in these short 15-minute visits that they have with them. Essentially, it's not even enough time to get the context of what's happening to these people. And what she's noticing over her 25-year career is essentially that these meds are given to people at younger and younger ages, despite the fact that we don't have good data on the long-term safety of these drugs on developing brains. Now, unfortunately, the study ends with Dr. David Healy, who I'd say is the world's leading expert on PSSD. You can find him at his blog, davidhealy.org or rxisk.org. These are his two websites where he talks a lot about this. And essentially, he's talking about the rate of suicide in the people suffering from this. He says in the past 2 years alone, he's known more than a dozen people who have taken their lives because of this condition, which is a harsh reality of just how severe this condition is. And he says that he believes that these teenage antidepressants are doing more harm than good. He says that young people typically get depressed, they get distressed, and when you're a teenager, you go half crazy. Most of us do. It's part of being a teenager. You've got to learn to work it out and cope with the world. Now, here's something about that comment. If you said that in any like mainstream places right now, they'd say, oh my God, you are so insensitive, Dr. Healy. You just want people to suffer. You are telling them to suffer with anxiety and depression. And I have to say, I completely agree with him. We are so quick to normalize normal struggles, not just in teens, but also in young adults and adults. Part of growing up is having uncomfortable emotions and having to reason with them. You have to be lonely. You have to have relationship problems. You have to be uncomfortable. You have to be in jobs that you don't like. And essentially, you have to figure these things out. Obviously, you should get help if you're on the verge of suicide, but we shouldn't be saying that, oh, depression and anxiety, that's so bad, let's get you on a medication. We are doing people a disservice. We're not allowing them to properly develop emotionally by struggling with these things. This is part of proper emotional development. In fact, we are putting them in the line of fire to develop permanent sexual problems, which lead to a lot of people taking their life. So there you have it. That's my take on this article. I'm so happy people are talking about this finally. In my perspective, this is the biggest story out there that we are essentially we've put, nearly 20% of women on these medications, which have the potential to cause permanent sexual dysfunction and emotional problems. No one's talking about it. Doctors aren't talking about it. It is a disaster. If you're interested in learning about the lived experience of PSSD, you're not going to want to miss this interview that I did with Sean just over here.